You likely know the feeling. Waking up to knees that stubbornly refuse to bend, hands that throb while preparing a meal, or that sharp catch in your hip the moment you try to stand up. This data represents a global reality. Over 600 million people worldwide share this exact physical struggle. That is a population larger than all of North America living with the daily grip of joint pain. This pain quietly shrinks a person's world. It turns a simple walk to the market, a full day of work, or even sitting with family at a community gathering into a daunting physical challenge. Osteoarthritis is the most common joint disorder on the planet, altering the daily lives and mental well-being of millions. For generations, many have believed a simple explanation for this pain. Our joints are like door hinges. We are told that years of walking, working, and lifting simply grind down our cartilage, like the tread wearing off a car tire. Believing in this mechanical decay leads to a very logical but dangerous reaction. People stop moving. They try to save whatever cartilage they have left by resting as much as possible, avoiding the very activities they love. Modern research reveals that joints are dynamic, living systems. The old model of passive decay misinterprets our actual biology. Treating your skeleton like a machine that is simply running out of hours only accelerates the decline. To keep moving, we have to rethink exactly what a joint is. A healthy joint is an active, living ecosystem. Much like a garden, it continuously grows, repairs itself, and reacts to its environment. Comparing a healthy joint to an osteoarthritic one reveals an active breakdown. Cartilage thins, bone thickens, and muscles shrink. Under stress, the joint releases pro-inflammatory chemical alarms that actively digest cartilage and damage surrounding tissues. This process creates the classic physical signs: pain that flares up during or after activity, stiffness in the morning, and the sensation of the knee catching or locking. Because osteoarthritis is an active inflammatory disease process, patients can actively manage and fight it. While getting older does change the cellular makeup of our tissues, age alone does not dictate who develops the disease. A torn ligament from youth or a fracture from a bad fall can subtly shift how a joint bears weight. Decades later, that altered mechanical stress acts as a catalyst for inflammation. Excess body weight creates a powerful dual threat. Fat tissue is an active organ that releases inflammatory chemicals into the bloodstream. These chemicals travel to and attack the joints, while the extra weight physically increases the pressure on the cartilage. This anatomical map highlights the most vulnerable targets for these combined stresses. The disease zeroes in on our primary weight-bearing and heavily used structures: the knees, the hips, the lower spine, and the specific joints in the hands. Osteoarthritis targets vital structural joints through a predictable combination of physical load and biological stress. When a joint hurts, every instinct tells you to stay perfectly still. Yet, giving in to that instinct starves the tissue and speeds up the disease. Cartilage doesn't have its own blood supply. It relies on rhythmic movement to act as a mechanical pump, pushing nutrient-rich, lubricating fluids in and out of the tissue, much like squeezing a sponge in water. Physical therapy and exercise build the surrounding muscles. These muscles act as shock absorbers, protecting the joint from the impact of daily movement. Breaking the cycle of inactivity is a necessary step to re-engage the joint's natural maintenance systems. Shedding even a small amount of weight provides significant relief. It lessens the physical load on the knees and hips while simultaneously reducing the volume of inflammatory chemicals circulating in the body. Assistive devices like canes, braces, and supportive shoes are clever mechanical tools. They redistribute weight and protect the vulnerable joint complex. Doctors can also deploy specific medical interventions, from over-the-counter anti-inflammatories to targeted joint injections. These tools are designed to ease pain so the patient can keep moving. When the joint architecture is completely compromised and conservative management fails, surgeons can perform a joint replacement to restore function, a highly successful but final resort measure. By treating your joints as living, responsive tissues, you can actively protect your mobility and write your own future.